So enhanced recovery is a strategy of perioperative management that aims to hasten recovery. So there's three main components to that. The first one is early feeding, the second is euvalemia, and the third is multimodal pain management. So the early feeding is important because we know that patients who are nutritionally replete have better outcomes, they heal better. And so patients who don't have good nutrition, that's something we want to optimize before surgery, potentially with prehabilitation. For other patients, we want to minimize the amount of calories that we withhold from patients around the time of surgery. So traditionally, we would not let them eat, for instance, after midnight. We wouldn't let them eat very much after surgery as well. So now we allow patients to eat normally up to midnight the night before surgery. They can drink fluids up until 2 hours before surgery, and then they're fed immediately after surgery. The second important thing is euvalemia. So we want to make sure that patients have the right amount of fluid, not too much or too little. If they have too little, they can get problems with perfusion in organs such as the kidneys. If they have too much fluids, that ends up having higher chances of things like surgical site infection. And also it's just unpleasant for patients when they have 10 or 20 liters of fluid during surgery or after surgery. So we really try to give the right amount of fluid, and that's actually very important for patient recovery as well. And then the third thing is multimodal management, or multimodal pain management. So I think most people are aware of the American prescription epidemic we have with opioids. And so one of the important things with enhanced recovery is, especially through euvalemia, we can improve pain control. And so we do things like giving ibuprofen and Tylenol and those sorts of things. We also inject the incision with local analgesia. And so we can minimize the amount of opioids that we give to patients after surgery. So for instance, in our practice, we've reduced the amount of opioids given in the first 48 hours after surgery by about 90%. And then also post-operatively, we will give a lot fewer prescriptions for opioids as well. So we expect to save about 35,000 pills a year just in gynecologic surgery through those efforts.